Santa Clara County has a residential population of 1.8 million and an average daytime population of up to 2.2 million people. The county occupies 1,132 square miles, two-thirds of which is sparsely populated rural landscape. Santa Clara County is an urban center, home to a large population of workers, builders, innovators, and thinkers. The EMS system operates around the clock, responding to emergencies. Each year, the county's 911 call centers receive approximately 120,000 calls, and about 75% of those calls result in a patient transported by 911 ambulance. Each year, the county averages 150 EMS air resource responses to 911 calls, flying two-thirds of those patients to hospitals. The county's 911 system is flexible and diverse. The EMS agency accredits and regulates the practice of more than 2,500 emergency medical technicians, over 800 paramedics, and over 20 accredited EMS field supervisors. Those personnel work 24 hours a day, 365 days per year for 11 fire departments, 11 ground ambulance services, and 2 air ambulance services, all on duty and ready to respond at any moment. To get those 911 resources where they need to be, Santa Clara County has 13 primary public safety answering points or 911 call centers, 3 secondary public safety answering points, 9 private ambulance dispatch centers, and 2 EMS air resource dispatch centers, all ready to answer the call for emergency and non-emergency medical needs. 911 dispatchers provide emergency care instructions to callers to help stabilize critical patients before help arrives. These instructions can be life-saving. Care doesn't stop with the EMTs and paramedics. Santa Clara County has 12 acute care hospitals with a total of 11 emergency departments able to receive 911 patients by ambulance. For patients with special needs, there are 10 stroke centers, 8 STEMI centers with capabilities for advanced cardiac diagnostics and care, 3 certified trauma centers, and a burn center. Across all hospital facilities in Santa Clara County, the county treats over 2,500 stroke patients, over 450 STEMI patients, and over 6,000 trauma patients each year. These patients come to Santa Clara County hospitals in various ways, including 911 and non-911 ambulances, EMS air resources, and walk-in to emergency departments. Each of these specialty cases requires care, both in the field and in the hospital, that surpasses the standard EMS hospital model. Santa Clara County specialty centers and pre-hospital medical protocols ensure that critically ill or injured patients are taken exactly where they need to be quickly and safely. Operating in the county system are 55 dedicated 911 county ambulances. Depending on the time of day, there are between 24 and 34 county ambulances in service in the exclusive operating area, and up to 3 more Palo Alto Fire Department ambulances serving the City of Palo Alto exclusive operating area. These ambulances respond to medical 911 calls. There are also over 150 fire apparatus, over 150 private ambulances, 2 EMS air resources, and 18 county and fire department EMS support units, including supply trucks and trailers, and EMS field supervisor vehicles. 911 dedicated county ambulances and the fire departments all staff EMTs and paramedics trained to deliver the same expert care. The fire department often arrives before the ambulance and initiates medical assessment and treatment, also performing essential scene control and rescue operations to enable the county ambulance crew to continue treatment and transport patients to hospital emergency departments. The private ambulances typically operate outside the 911 system, every year treating and transporting over 60,000 non-emergency patients between medical facilities. When 911 call volume surges, many of those private ambulances will instead respond to 911 calls to deliver the same standard of care as their 911 peers. EMS air resources respond to 911 calls in remote or isolated areas to treat and transport patients to emergency departments throughout the region. This is the equipment that gets the county where it needs to be to help you, your family, and the 2 million plus residents and guests of Santa Clara County. For those about to begin their EMS career, there are 7 emergency medical technician training programs and 2 paramedic education programs permitted within Santa Clara County. Local training programs receive priority for intern and ride-along placement with local providers. Santa Clara County EMS recognizes that preparation is the key to success in the critical moments following a large event. The county maintains caches of key medical supplies in case of disasters, both natural and man-made. Soon after such an event, the county can deploy extensive medical response resources, such as field treatment sites to manage a surge of patients, or specialty service trailers to provide additional medical logistical support, such as extra radios and a cabana trailer for command personnel during multi-patient events. The county maintains caches of communications equipment and medical supplies such as bandages, emergency medications, and oxygen. The county can rapidly activate and staff the Medical Health Operations Center, a facility that supports the management of large-scale multiple patient events efficiently and effectively. And the Disaster Medical Support Unit carries medical supplies to restock busy ambulances and fire engines working through disasters. So, to summarize, over 2,500 emergency medical technicians, over 800 paramedics, and over 20 accredited EMS field supervisors use 55 dedicated 911 county ambulances, 150 fire apparatus, over 150 private ambulances, 2 EMS air resources, and 18 county and fire department EMS support units to cover 1,132 square miles, all to provide quality patient care for an average daytime population of up to 2.2 million people.